Good evening, everybody. We are here right now to talk about rapid testing and mass testing, because people are talking about it a lot right now. No? I'm very fortunate that one of my grade school classmates and batchmates from Xavier, Dr. Benjamin Nachiketa, no, is here with us, no, to help us understand the medical side and the science behind all of this testing issues. Hi, Benjo. Welcome. Can you tell us a little something about yourself so our viewers can also get to know you?
Good evening. I am Dr. Benjamin Nachiketa. My nickname is Benjo. I am currently an internist cardiologist working at the Philippine Heart Center, University of Santo Tomas Hospital, MC Hospital, and other other secondary hospitals here in Metro Manila. So before I became a cardiologist, I took up internal medicine, which encompasses almost all specialties involving adult adult diseases. So more or less, um, I have knowledge on the topic, and of course, a lot of patients go to me for clearance. That's why this is a very relevant topic.
Okay. Uh, so sige, I'll ask you some of the questions. We'll keep it short. I'll ask you some of the questions that uh, we have collected. No. First of all, no, we've been hearing about the test called PCR, rapid testing. Can you tell us about it? Can you explain to us what PCR and rapid testing is? Are they one and the same thing?
They're different. So the gold standard for diagnosing COVID-19 is through the detection of the virus through the RT-PCR, or reverse transcriptase polymerase chain reaction method. So in this method, you would be able to detect the live virus. So we are dealing with an RNA virus. So the virus responsible for COVID is called um, SARS-CoV, and it is an RNA virus found in nature, found in um, found in respiratory droplets. That's why when we get a sample, when we get a swab from the nose, from the mouth, um, certain chemicals are applied in order to get the RNA remnants, and these RNA remnants are placed in a machine. Okay, then wherein the RNA is converted to a DNA, and this DNA, which is a genetic component of everything. So so the machine would amplify this DNA, and if the machine gets the genetic material of the virus, we are almost certain that we are dealing with the SARS-CoV virus, which is responsible for COVID. The rapid testing, on the other hand, would detect antibodies that we get if we had the virus. So, what are antibodies? The virus is the antigen, so it is the one. It is the it is it is the antagonist. So so it is an antagonizer, and our body creates an immune response in order to fight that antagonizer. So our body produces antibodies. So there are two types of antibodies that we evaluate: your IgM and your IgG. So the IgM antibody is the first antibody that comes out after an infection, usually around 3 to 5 days after an infection. While if the IgG antibody comes out, it means that you're already on the process of healing, or you already had the infection. So it represents uh, a past infection. So um, they're different in the sense that your RT-PCR would detect the virus itself, while the rapid testing would detect antibodies uh, brought about by the viral infection. But one striking difference is the speed of getting the results. For rapid testing, you could get the results 30 minutes after getting your blood. However, for PCR, it would take 5 to 7 days because it needs further validation. And um, for RT-PCR, you really would need trained medical technologists in, in order, because the DOH doesn't allow each laboratory to perform an RT-PCR. They would have to train, and they would have to make sure that the results are sensitive and valid. So that's the difference. RT-PCR to detect the virus, rapid testing to detect antibodies brought about by the virus.
Okay. So, yung right now, Benjo, no, marami sa Facebook nagbebenta nung, of course, we don't see the PCR being sold sa Facebook. We see a lot of people selling rapid tests.
Mm-hmm.
Actually, they're being sold to us now as employers. Uh, it ranges from around mga 450 pesos to 1,000 pesos. Is this something that we as laymen can just get parang over the counter na pregnancy test we can administer on our own? No?
No, it's kind of scary because we don't know the sensitivity and specificity of these rapid tests that are being sold. So it's better to get your rapid test in a certified hospital, wherein we are sure that the sensitivity and specificity of the rapid test is high. Kasi hindi tayo
Okay.
sigurado na maraming hindi natin masabi kung fake yung mga rapid testing, tapos magkaroon ng false negative or false positive results. Kasi pwede siya mag-false negative kung mababa yung immune response ng isang patient. Tapos pwede siya maging false positive if ma-detect na ibang virus. So,
Okay.
so yung mga rapid test talaga, tinetest yung sensitivity at saka specificity. And it's a tedious process to undergo to test the sensitivity and specificity of the rapid test.
Okay. Correct me lang if I'm wrong, how I understand how you explain it from a layman's understanding. No? Parang yung rapid test is like nangyari na yung gera, tapos dumating yung sundalo, which is your antibodies. Kumbaga ito yung mga remnants to parang na-explain niya, nagkaroon ka ng virus only because of the presence of your antibodies, no? Or yung mga sundalo dun
Yes.
sa gera, but not
Yes.
exactly the virus itself. So nagkakaroon tayo ng
Yes.
false positive because it's possible that those antibodies were sent, but not specifically for the COVID virus, but for
Yes.
another identical virus, di ba?
Yes. Yes.
So parang
Yes.
mag-react ka. At the same time, pwede maging false negative because to begin with, wala ka nung mga sundalo na yon.
Yes.
Parang, is that my
Wala kang
understanding?
immune response. Yes.
Wala
Yes.
kang immune responses. No? So,
Yes.
yeah, that's how I understand it. So, the rapid test doesn't exactly test the existence of the virus, but the existence of your body's capacity to react to a virus.
Yes.
Tama
Yes.
ba?
Tama.
Okay.
Tama.
So that being said, parang I saw a recent issuance by the PMID na that they don't really recommend without really saying it. Parang they're saying that it's not really an accurate test as of the moment. Diba? Parang they're very careful to say that based on evidence that they have received, no, it has not produced a conclusive result. No?
Yes. Yes. That's why you have to make tandem testing with RT-PCR. We already know from guidelines that if the patient is symptomatic and highly probable of COVID, and if the patient has exposure, uh, your RT-PCR is the gold standard. But
Yeah.
if you would like to have a bird's eye view of the results, you do tandem testing with your serologic antibody testing. Kasi like right now, I have a patient in heart center who is a COVID suspect based on X-ray and CT scan because the CT scan exemplified this ground glass appearance, which is typical of COVID. So an RT-PCR was done, a nasal swab was done, but the results would come out around 7 days. And an antibody testing was done also yesterday, which turned out negative for IgM and IgG. So may scenarios yan, pwedeng false negative, pwedeng false negative kasi baka masyadong early yung pagkuha ng antibody testing na hindi pa nagmamount ng antibodies yung katawan. So, kahit na negative yung result, hihintay pa rin namin yung RT-PCR. That's why we still treat the patient as a COVID patient na naka-isolate pa rin siya. So, yun talaga yung silbi ng antibody testing. Pero granting na if ever, different scenario, same patient, pero nag-IgM positive siya. So, ibig sabihin, tapos meron siyang symptoms of COVID, tapos hindi pa lumalabas yung antibody testing, almost certain tayo na may COVID yung patient. So, we'll just wait for the RT-PCR to confirm.
Confirmatory. So, in a way, may use pa rin naman pala yung rapid test, except that you just cannot rely on it to make 100% decisions. Parang ganon yung...
Yes.
Is that how I understand?
Pwede rin siyang gamitin sa asymptomatic population. Like, sa case namin, sa unit namin sa hospital, yung trainee ko, yung fellow ko, pinag-quarantine siya kasi nagkaroon siya ng cough and fever. So, nag-quarantine siya for 2 weeks. Pero during that time, hindi pa available yung RT-PCR. Tapos, nagkaroon ng mandate yung hospital namin, yung heart center, to do mass testing. Kahit ano lang, antibody testing lang. So, siya inuna kasi nagkaroon siya ng symptoms. Nag-positive siya for IgG. So, IgM negative na siya. IgG positive siya. So, ibig sabihin, nagkaroon siya ng recent infection, healed. Pero, nung tinest siya ng antibody testing, asymptomatic na siya. So, the hospital had to call all of us, yung sa unit namin, pinag-test kami just to make sure na hindi kami na-expose sa kanya. Though, asymptomatic kami. So, lahat naman kami IgG, IgM negative. So, if ever asymptomatic kami, kasi maraming mga asymptomatic carriers, you don't know that.
Yeah.
So,
yung delikado actually ngayon, ano?
So, yun yung silbi ng antibody testing to detect the asymptomatic carriers and also to identify the individuals who would need RT-PCR. Kasi pwedeng asymptomatic carrier siya na nag-IgM positive. IgM, ibig sabihin may viral shedding siya. Okay. Kasi pwedeng IgM positive siya, pwedeng IgM, IgG positive siya, nasa latter part na siya ng disease, pwede siyang IgG positive, healed na yung disease. Yung sa hospital namin, either of the 3 scenarios, you need to undergo RT-PCR just to make sure that you are negative. Tapos pinapag-quarantine na rin yung patient. So, may silbi rin yung antibody testing. Pero kasi, ang contention is, hindi pare-pareho yung sensitivity at specificity. So, kailangan alam ng hospital kung saan nanggaling yung antibody kit. So, hindi tayo pwede mag-rely. So, kasi bago pa lang yung COVID So, wala pa talaga tayong generalized testing or parang standard kit for that. So, that's why I think the DOH did not propagate antibody testing. Kasi iba-iba yung sensitivity sa specificity. So importante, symptom guided pa rin tayo when we clear patients for work.
Okay. Yung you mentioned nabanggit mo yung mass testing, no, Benjamin? And from the start of the quarantine, no, people were already advocating na let's do mass testing. Parang, but ako to be honest, I don't understand. What do you mean by mass testing ba?
Okay, from the word itself, mass testing. So you test a group of individuals. Of course, you need to have a purpose. So these group of individuals are at high risk of getting COVID. It's either these individuals are exposed to one or two persons who are COVID positive or COVID suspects, or or they may be um, or they may be frontliners, or they may belong to the vulnerable population. So so you just would have to identify a certain set of individuals with who share common characteristics.
Okay.
But right now, I think it is not feasible to do mass testing for everyone, especially in asymptomatic individuals who do not have exposure, who have low risk for COVID. I think you could not push these individuals to undergo um, testing, be it serologic testing or RT-PCR,
Pero yung
because
idea is to
yung
get everyone tested. Is it ideal to get everyone tested?
um, that's the ideal scenario, but in a pandemic, that's the ideal scenario. But we know that lack
Resources, yeah.
we lack resources, and we lack test kits. That's why
Yeah.
we have to prioritize the ones who are in need. That's
Yeah.
why we
Okay.
won't be able to do it even in America. Uh, they aren't able to test everyone. That's why we have to prioritize our resources.
Yeah. Yung there has just been a recent confusion, no, regarding policies of the government regarding mass testing and make it mandatory yung testing for employees before they come into, everybody's going back to work now. Most of the people
Mm.
are going back to work now. And then nagkaroon ng confusion during the weekend if they are required to do the mass testing. I am a management lawyer now. I've been doing labor practice for quite some time, and I advocated, no, during this weekend na it shouldn't be mandatory for the government to impose that expense on the employer. First of all, because hindi naman siya accurate, di ba? So parang
Mm.
we're spending on something. Tapos, in my thinking, this is what I want you to correct me if I'm wrong. Kasi pag if I test my employees today, tapos
Mhm.
bukas magko-commit naman sila pa uwi. Di ba?
Yes.
Magko-commit sila, they'll interact with the people outside, public transport. Do I have to test them every day? Di ba? Parang that's what I was
Yes.
actually
Yes.
very apprehensive about it, di ba?
Yes, kasi kung mag-negative sila for today, tapos ma-expose sila tomorrow, pwede
Ganun
silang
talaga.
mag-positive tomorrow. Kaya ang kailangan i-emphasize natin is social distancing, um, hand hygiene, more of recognizing symptoms of COVID, more of um, more of preventive measures. Kasi like me, nag-negative ako 2 weeks ago. So, pero pwede ako mag-positive ngayon kasi nag-rounds ako sa mga pasyente. That's why right now I'm extra careful. I wear the proper PPEs, and as much as possible, um, I don't go face to face with the patient. I think that's what we have to emphasize and reiterate. Kasi yung antibody testing, it's very transient eh. You might be
Yeah.
negative now, tapos pag hindi mo na modify yung habits mo, pwede na mag-positive. Pero like yung sinabi ko kanina, may use din yung antibody testing.
Yeah,
I
yeah.
think for high risk and vulnerable individuals such as healthcare workers.
Yeah, parang pwede, no? Oo. I was thinking nga parang it makes sense for the hospitals na nagjo-duty at least yung nalilimit yung pag-quarantine nyo, di ba? Parang pag alam mo may antibody ka na, you don't have to quarantine every time you go on duty. Kasi I understand right now, what doctors are doing is that nag-rotate there every 14 days. So that to
Yes.
see kung kailangan i-quarantine. So if you already register for the antibodies, the IgG, you don't have to do quarantine kasi more or less tapos ka na, di ba? Parang that's how I understand it, no?
Yes, lalo yung mga frontliners, yung mga
Yeah.
sa heart center, ang ginagawa doon, 5 days straight sila na every other day na duty. Tapos, antibody testing. Tapos, so from there, makikita if mag-positive sila. Kung mag-positive sila, swab ka agad kahit walang symptoms. Kasi, na-expose sila eh. Kasi high risk population ang frontliners. Pero pag negative, asymptomatic, they still would need to undergo quarantine, pero they don't need to be swabbed.
Okay.
So parang guide yun para kung sinong isa-swab or hindi.
Okay. I'll ask you a few more questions pa. I don't want to keep you also too late. No? Yung isa is, since most of us are employers, and of course, DOL issued regulations na, DOH, but you as a doctor, no, what would you advise us to do? No? What's the process before we take in our employees coming back to work? No? What do you advise for us that we do?
I'm sure that you have doctors and nurses in your company, right? I guess at least a nurse should do a basic history and physical examination on the employee with emphasis on symptoms related to COVID, exposure to patients who exposure to COVID suspects, and history of travel. And it really depends on the doctor if the doctor or nurse will request for labs such as a complete blood count, a chest X-ray, depending on the physical findings on the history and physical examination. So I think more or less it would need to be examined by a healthcare worker first, and this doctor or nurse could decide whether the patient should be tested or not.
Okay.
That's my advice, and of course we need to make policies that would enforce social distancing, wearing of protective equipment. Of course, it's a new normal.
Okay. My last question for you, Ben, is what's your outlook on all of this? How do you see all of this panning out? Are you optimistic? Are you pessimistic about this COVID-19? Where are we going to end up?
It's really a hard question, but I'm optimistic because as compared to other countries, I think Filipinos are more obedient as compared to America, because you see, they're already opening their restaurants, and at least Filipinos are more obedient. So I am optimistic for our country. I think I think the policies are not perfect, but we're on the right track because the number of deaths are not escalating. Kanina 7 di ba? Hopefully ma-maintain yung ganung number.
Momentum, yeah.
Though tumataas pa yung number of positive cases, but I think we're being given a better picture. I'm pretty optimistic that we will get through this.
Okay, that's very comforting to know. Thanks again, Benjo, for your time. I know you're very, very busy, and rest is very important to you right now. We want you to keep safe, no, and let us know if there's anything we can do also for you guys, PHC.
Okay.
Okay, thanks, Benjo. Nice to chat with you again. Huh?
Okay.
Bye-bye.
Sige, bye-bye.
So there you have it, our friend Dr. Benjamin Quito. Thank you for explaining to us what rapid testing is, PCR, mass testing, and we have been confused about it. It looks like something that has been talked about the past few days, the past few weeks, without us really understanding what it's all about. No? So I hope our policymakers also try to understand what this is all about before they, turn it into an ordinance, turn it into a mandatory thing. Uh, at the end of the day, we just all want to get out of this COVID-19 situation. But we cannot add to the confusion already by doing things that we don't understand. Okay, so we hope that you continue to watch some of our information videos about COVID-19, the ordinances and the laws that are coming up around, coming about and being issued, and we hope to uh, be of service to you that way. So thank you again. Thank you for taking time. Bye.